Dr. Sims, the devil of gynecology. In a small slave cabin in 1840s Alabama, a young woman named Anarcha screamed as a white doctor prepared to cut into her body for the 30th time without anesthesia, without her consent, and without any guarantee she would survive the procedure. Her pain was considered irrelevant, her humanity dismissed, and her body treated as nothing more than experimental material for a physician who would later be celebrated as the father of modern gynecology. This is the story of Dr. J. Marion Sims, a man whose medical innovations built a foundation of women's healthcare upon the tortured bodies of enslaved black women who had no choice but to endure his experiments or die. Welcome to this Duel of Concepts deep dive, where we confront one of medicine's darkest chapters and examine how the celebrated achievements of modern gynecology emerged from a legacy of exploitation, racism, and medical violence that mainstream history has spent centuries trying to sanitize. James Marion Sims was born on January 25, 1813, in Lancaster County, South Carolina, into a world where slavery was not just legal but fundamental to the economic and social structure of the antebellum South. His father, John Sims, was a sheriff and hotel keeper who owned enslaved people, providing young Marion with early exposure to the dehumanization that would later enable his medical experiments. The Sims family represented the Southern white middle class that benefited directly from enslaved labor while maintaining social respectability through community involvement and Christian piety. Sims' early education followed the typical pattern for Southern white men of his class. He attended South Carolina College, now the University of South Carolina, graduating in 1832 with a classical education that emphasized Latin, Greek, and moral philosophy. Ironically, the same moral philosophy that should have prevented the horrors he would later inflict. His college years occurred during a period of intense national debate over slavery, yet like most Southern whites, Sims absorbed pro-slavery ideology that portrayed enslaved people as naturally inferior and suited for bondage. After college, Sims initially planned to study law but switched to medicine, enrolling at Jefferson Medical College in Philadelphia in 1833. His medical education, typical for the era, emphasized anatomical knowledge gained through dissection and observation, but provided minimal training in surgical techniques or anesthesia, which was still in its infancy. Most importantly, his education included no ethical training regarding patient consent, medical experimentation, or the rights of marginalized populations. Upon completing his medical degree in 1835, Sims returned to Alabama and established a practice in Montgomery. His early medical career was unremarkable, treating the typical ailments of rural Southern life among both white and enslaved patients. However, his position as a white physician in a slave society meant he had unprecedented access to enslaved bodies, which white owners often offered to doctors for experimental purposes, viewing their enslaved property as expendable test subjects for potentially beneficial medical procedures. The catalyst for Sims' infamous experiments came in 1845 when he encountered his first case of vesicovaginal fistula, a condition where tears develop between the bladder and vagina, typically resulting from prolonged or traumatic childbirth. The condition left women unable to control urination, making them social outcasts and, in the case of enslaved women, often worthless as laborers in their owners' eyes. Traditional medicine of the era considered such injuries incurable, condemning affected women to lives of pain, humiliation, and isolation. For white women suffering from fistulas, this condition meant social exile and marital discord, but they retained legal rights and social status that provided some protection from experimental procedures. Enslaved women with the same condition, however, had no legal rights, no ability to refuse medical treatment, and no social value once they became incontinent. This legal and social vulnerability made them perfect subjects for Sims' experimental ambitions. The three women who would bear the brunt of Sims' experimental obsession were Anarcha, Betsey, and Lucy, names we know only because Sims recorded them in his medical notes, though he never acknowledged their humanity or suffering in his published accounts. Anarcha, believed to be around 17 years old, had developed a severe fistula after a prolonged labor that lasted 3 days. Betsey and Lucy suffered similar injuries, and all three were essentially discarded by their owners, who saw no economic value in women who could no longer work effectively due to their incontinence. Sims convinced the women's owners to let him attempt surgical repairs, promising to return valuable laborers to productivity. What he didn't reveal was his intention to use these women as ongoing experimental subjects, repeating surgeries until he perfected his technique regardless of their suffering. The women had no choice in the matter. Enslaved people could not legally consent to or refuse medical treatment, and their owners had complete authority over their bodies. Between 1845 and 1849, Sims performed experimental surgeries on these women without anesthesia, despite the fact that ether had been successfully demonstrated as an anesthetic in 1846. His justification for operating without pain relief relied on racist pseudoscience, claiming that black women felt less pain than white women, a belief that conveniently enabled his experiments while absolving him of guilt over the agony he inflicted. Anarcha alone endured 30 operations, each one performed while she was conscious and fully aware of every cut, every stitch, and every manipulation of her internal organs. Betsey and Lucy underwent multiple surgeries as well, with Sims documenting their physical responses while completely ignoring their emotional and psychological trauma. The women were forced to assist in each other's surgeries, holding retractors and witnessing their fellow sufferers' agony, creating additional layers of trauma and helplessness. The surgical environment Sims created was deliberately dehumanizing. He performed operations in a makeshift clinic behind his Alabama home, with enslaved women serving as his surgical assistants not by choice, but by command. The women being operated upon were positioned in what became known as the Sims position, a humiliating posture that exposed them completely while rendering them powerless to resist or escape. Sims developed several medical instruments during these experiments, most notably the Sims speculum, which he initially crafted from a pewter spoon. While later celebrated as an innovative diagnostic tool, the speculum's development came at the cost of repeated, non-consensual vaginal examinations performed on women who had no right to refuse. His technique for fistula repair, involving silver wire sutures and meticulous surgical positioning, was refined through dozens of failed attempts on the same 3 women. The psychological torture accompanying the physical pain cannot be understated. These women lived in constant fear of the next surgery, never knowing when Sims would decide another operation was necessary. They had no privacy, no dignity, and no hope of escape from their torment. Their bodies became battlegrounds where a white physician fought to perfect his technique, with their suffering serving as the price of his eventual fame. After 4 years of experimental surgeries, Sims finally achieved success in repairing Anarcha's fistula in 1849. However, his triumph came only after she had endured 30 operations without anesthesia, 30 episodes of conscious surgical trauma that would have broken most human beings. Betsey and Lucy were also eventually cured, though the psychological scars of their experiences would last lifetimes. With his technique perfected through experimentation on enslaved women, Sims moved to New York City in 1853, where he established a practice treating white women with the same condition. The contrast in his treatment of white versus black patients was stark and revealing. White women received anesthesia during their surgeries, were treated in comfortable medical facilities, and were consulted about their treatment preferences. The techniques Sims had brutally developed on enslaved women were now offered as compassionate medical care to those society deemed worthy of dignity and pain relief. In New York, Sims founded the Women's Hospital, which became one of the first institutions dedicated specifically to gynecological care. His reputation grew rapidly as he successfully treated conditions that other physicians had deemed incurable. Medical journals praised his innovative techniques, international colleagues sought his expertise, and grateful patients elevated him to celebrity status within New York society. The irony was profound. Sims built his reputation as a compassionate healer of women's ailments on a foundation of female suffering he had deliberately inflicted. His medical innovations, celebrated as breakthroughs in women's healthcare, emerged directly from the torture of women who had no choice but to endure his experiments. The techniques that brought him fame and fortune had been purchased with the blood, tears, and screams of enslaved women whose names were barely recorded in medical history. Sims' writings about his Alabama experiments reveal a disturbing disconnect between his actions and his self-perception. He described his work as humanitarian, claiming he was motivated by desire to help suffering women. He portrayed the enslaved women as willing participants in his research, completely ignoring the coercive nature of their situation and their inability to consent. His accounts erased their pain, their resistance, and their humanity, reducing them to clinical observations and surgical challenges. The medical establishment of Sims' era enthusiastically embraced his work without questioning the methods by which he developed his techniques. The American medical profession in the 1850s was deeply embedded within racist social structures that normalized the exploitation of black bodies for white benefit. Sims' experiments were not seen as aberrant but as innovative applications of available resources in enslaved women's bodies to advance medical knowledge for the benefit of those who mattered in society. International recognition followed domestic acclaim. Sims traveled to Europe, where he performed surgeries for royalty and trained European physicians in his techniques. He was elected to prestigious medical societies, received honorary degrees, and was celebrated as one of America's greatest medical exports. European medical establishments, despite their growing criticism of American slavery, welcomed Sims without questioning how his techniques had been developed. The construction of Sims' heroic narrative required the deliberate erasure of Anarcha, Betsey, and Lucy from medical history. Early accounts of his work mentioned them only as material or subjects, stripping away their names, their suffering, and their unwilling contributions to medical progress. This erasure was necessary to maintain the fiction that Sims was a benevolent healer rather than a medical torturer who had built his career on the systematic abuse of powerless women. Medical textbooks for decades presented Sims' innovations without mentioning the circumstances of their development. Students learned to use his instruments and techniques while remaining ignorant of the pain and exploitation that created them. This sanitization of medical history allowed generations of physicians to benefit from Sims' methods without confronting the ethical implications of how those methods were developed. The legacy of Sims' experiments extended far beyond his individual career. His work established precedents for medical experimentation on marginalized populations that would continue well into the 20th century. The assumption that black bodies were available for medical exploitation without consent became embedded in American medical culture, contributing to later atrocities like the Tuskegee syphilis experiments and contemporary disparities in medical care. Sims' career also demonstrated how medical progress could be achieved through systematic violation of basic human rights, yet still receive social and professional acclaim. His story reveals the medical profession's willingness to celebrate results while ignoring methods, to honor innovations while erasing the suffering that created them. This pattern of selective moral blindness would characterize American medicine's relationship with racial exploitation for generations. The psychological trauma inflicted on Anarcha, Betsey, and Lucy represents a dimension of Sims' crimes that medical history has barely acknowledged. These women lived with the knowledge that their bodies had been used as experimental material without their consent, that their pain had been dismissed as irrelevant, and that their suffering had been transformed into another man's glory. The healing they eventually experienced came at the cost of psychological wounds that no surgery could repair. Modern gynecological practice continues to use instruments and techniques developed through Sims' experiments, creating an ongoing ethical dilemma for the medical profession. Every use of a Sims speculum, every application of his surgical techniques, carries the legacy of the enslaved women who were tortured to develop them. This connection between contemporary medical practice and historical exploitation raises uncomfortable questions about how the medical profession should acknowledge and address its dark past. Efforts to recognize Sims' victims and reassess his legacy have grown in recent decades. Anarcha, Betsey, and Lucy are increasingly acknowledged as pioneers of gynecological surgery, not willing pioneers, but women whose forced suffering made modern women's healthcare possible. Some medical institutions have begun including their stories in educational programs, ensuring that future physicians understand the costs of medical progress. The removal of Sims' statues from public spaces reflects growing recognition that celebrating his achievements while ignoring his methods perpetuates the devaluation of Black women's lives and suffering. These removals represent acknowledgement that medical progress achieved through torture should not be honored without simultaneously recognizing the victims whose pain made that progress possible. Contemporary medical ethics, with its emphasis on informed consent and patient autonomy, stands as a direct response to the type of exploitation Sims practiced. The principles that govern modern medical research, voluntary participation, risk disclosure, right of withdrawal, were developed specifically to prevent the kind of abuse that characterized Sims' experiments. Yet disparities in medical care suggest that the attitudes underlying Sims' work have not been entirely eliminated. The intersection of racism and medical exploitation that characterized Sims' career continues to influence healthcare disparities today. Black women still experience higher rates of maternal mortality, receive less adequate pain management, and face dismissal of their medical concerns, patterns that echo the dehumanization that enabled Sims' experiments. Understanding his legacy is crucial for addressing contemporary inequities in medical care. Medical education has begun to grapple with how to teach Sims techniques while acknowledging their origins. Some programs now include discussions of medical ethics alongside technical training, ensuring that students understand both the benefits and costs of medical innovations. This approach seeks to honor the contributions of Sims victims while providing necessary medical knowledge to contemporary practitioners. Research into the lives of Anarcha, Betsey, and Lucy remains limited by the historical erasure of enslaved women's experiences. Scholars work with fragmentary evidence to reconstruct their stories, fighting against centuries of deliberate omission from medical records. This research represents an attempt to restore agency and humanity to women who were systematically dehumanized by the medical establishment. The global influence of American gynecology means that Sims' techniques and the suffering that created them have shaped women's healthcare worldwide. Medical schools across the globe teach methods developed through the torture of enslaved women, often without acknowledging this history. This international dissemination of techniques rooted in exploitation raises questions about the global medical community's responsibility to acknowledge historical injustices. Reparative justice approaches to addressing Sims' legacy focus on how the medical profession can make amends for past exploitation. Some proposals include funding healthcare initiatives specifically serving Black women, establishing scholarships for Black medical students, or creating research programs focused on addressing health disparities. These efforts seek to transform the legacy of exploitation into opportunities for healing and justice. The story of J. Marion Sims forces us to confront uncomfortable questions about how we balance medical progress with human rights, how we honor innovation while acknowledging its costs, and how we prevent the repetition of exploitation that has characterized too much of medical history. His legacy reminds us that scientific advancement without ethical constraints can become a form of sanctioned torture, and that the benefits of medical progress must always be weighed against the methods used to achieve them. If this examination of medicine's darkest chapter has forced you to confront the uncomfortable truth that some of our greatest medical advances were built upon the systematic torture of the most vulnerable among us, don't let this history remain buried in the footnotes where institutional memory prefers to keep its most shameful secrets. Hit that like button if this unflinching look at Dr. Sims has challenged your understanding of how medical progress is achieved and at whose expense. Subscribe to Duel of Concepts for more investigations into the figures whose legacies force us to question everything we thought we knew about heroes and villains in human history, and share in the comments how we should balance honoring medical advances with acknowledging the suffering that created them. Should we rename the instruments and techniques that bear Sims' name? How do we teach these methods while honoring their victims? Or what does true reparative justice look like for exploitation that happened generations ago but continues to benefit us today? Because in a world where medical miracles still sometimes emerge from the exploitation of the powerless, remembering Anarcha, Betsey, and Lucy isn't just about correcting historical records, it's about ensuring that never again do we mistake torture for treatment or confuse progress with justice.
Smile, you're watching a Duel of Concepts deep dive. Like, subscribe, and spread the joy. Comment your hot take.